Hi, I'm Darnell with Live Done Lifestyle, and I'm here again with Dr. Bashey at the ZO Skin Center in Beverly Hills. And today we're going to do the pulse dye laser. Why are you recommending this treatment for my skin?
So the pulse dye laser is a very, very versatile laser. It can be used for a lot of different skin conditions. We use it for acne scars. We use it, in your case, for generalized redness. We use it for a lot of different things.
This is no makeup. I have generalized redness.
Yeah.
I do.
And so for people that are lighter skin, fairer skin, who are living here in Southern California, getting a lot of that sun, the skin has a tendency to be diffusely red. And so how do you get rid of that? We really don't use creams so much. We can't really use a lot of different oral medications for that. So we have two choices. We have IPL with basically a red filter, or we have something that's a little bit more specific called the pulse dye laser.
Now, I never see the sun. Like, I'm very adamant about sunscreen. If you've seen any of my other videos, you know that that is true. But there is a genetic component also for rosacea, which you've diagnosed me with having.
Absolutely. So going back to what we were talking about a little earlier, a lot of people are red because they're getting a lot of sun exposure, and that's creating a lot of redness. But then some people are very red from rosacea. And if you've seen Darnell's videos, you've seen that, she explains a little bit about what rosacea is. And so we can use this laser for both types of patients. Patients that have that redness because they're out in the sun or because they're very fair skinned, or patients that have that redness from the blood vessels opening and closing with rosacea.
Right. Okay, so I might have no makeup on. I've already been numbed. I cannot feel my face at all. And we're gonna go ahead and get started.
Perfect,
okay?
Let's go ahead.
Let's do it.
This targets only hemoglobin, which is what makes you pink. So it's not a laser hair removal laser. It's not a CO2 laser. Okay. It doesn't burn things like that. It only targets red.
I don't want to say it's heat, but kind of heat.
Yeah, so it is, all lasers, remember, work through heat, right? And so right after the heat, you should feel a cold little, a little cryo spray.
Yeah, I do.
And so that is what prevents pigmentation after this laser is done.
So what else could this be used for?
This is one of my big lasers to go to for people that have acne scars. And a lot of acne scars are gonna leave that red mark, especially in very light-skinned people. That red mark is gonna stay there for a long time. We call that PIE, post-inflammatory erythema. So darker skinned people are gonna get post-inflammatory hyperpigmentation. Lighter skinned people are gonna get post-inflammatory erythema. And so I will use this laser on those candidates to get that red out, because the acne gets better, but it leaves this red scar that just sits there forever. So so I actually did this morning on a young girl who had the PIE from acne. You can also use this on keloids. You can use this on cherry angiomas, which are these little red spots that people have, blood vessels around the nose, on the face.
Varicose veins or no?
Generally not recommended to use lasers on the lower extremities, although some people do it. There's a higher risk of complications, things like that, yeah. So there's other modalities like sclerotherapy and things like that work better on the lower extremities than, for example, this.
Now, is this the same type of laser that's used for like tattoo removal?
No, totally different. So a tattoo laser is gonna primarily target pigment, and the target for this laser is not pigment, it's actually hemoglobin in the red blood cells.
Oh.
So the idea behind why you're red, whether it's the rosacea or the sun, is basically that your skin is producing, there's a lot of blood vessels there, and those blood vessels obviously have red blood cells, and the red blood cells have hemoglobin. So this targets only the hemoglobin. It only targets red. It will not target anything else. So we pretty much go through the entire face with this. You can see it's a relatively comfortable procedure when you're numbed up.
Yeah. I mean, there's a little bit of a shock value to it because of the bright light and the punch that the laser has.
Right. Now, if we change the settings and we kind of create more of a bruising type of setting, then it hurts a little bit, but we numb for that as well, and so it definitely is not as bad.
So what is the point of doing it to the point where it would bruise you?
Yeah, so if you think about what's going on with the blood vessel, right? So underneath the skin, we have a lot of these blood vessels. This will use heat and will make the blood vessel get smaller each time heat is applied to the blood vessel. If we use enough heat, we can burst that blood vessel and get rid of it. When the blood vessel bursts, it's gonna let go of its red blood cells, and those red blood cells are gonna be manifest. We're gonna see them as a bruise. So if you think about it, we can either use that heat to make the blood vessel shrink progressively 4 or 5 times, or we can hit it pretty hard once or twice, burst the blood vessel, and do it, you know, in that way.
Your body will just absorb it.
Exactly. Your body's just gonna absorb that purpura over the course of the next couple of days. So obviously these days, you know, people are not very into being bruised for a little while, but for the right person, the bruise setting works if you have that downtime.
Right.
Okay, that's it.
Ooh, that's it?
Yeah.
Oh.
Okay, so here we have the pulse dye laser. You could see that the energy is spread over a longer period of time. Because it's spread over a longer period of time, the chances of you getting bruised are a lot less.
So, but how many treatments do you need?
This can be done as frequently as every 2 weeks, but most people are gonna do it every 3 to 4 weeks, once a month to help control that redness.
Right, okay.
When you stop doing it, remember, those blood vessels come back from the sun, from rosacea, so this is something that ends up being a continued type of thing.
Right, so I'm using this kind of as maintenance. We're gonna do this, and we're doing the Clear and Brilliant.
The other type of laser is called a non-ablative laser. This laser is a non-ablative laser. So it transmits heat to the dermis without damaging the epidermis, hence the word non-ablation. Yeah, so after doing a series of them, what I would do is, then I would do them less periodically. Maybe I would do it twice a year or every couple of months or something like that as maintenance.
So that's it, I just finished my treatment. As you can tell, my face is even pinker than we started with, and that's a normal reaction, right?
Right, so it's normal to be, for about 48 hours, 24 hours after the procedure, to be a little bit more red.
So I signed up for a series of treatments. Every year I pick a different laser based on what my skin is going through. This year I have been pink. So we're doing this laser along with the Clear and Brilliant, which will be in another video. The link will be down there. And so we'll do a series of like 3 or 4, and then after that it's maintenance, right?
Correct.
So you would do
Correct.
how many times
Yeah,
a
so
year?
I would do it for the first year, I would do it several times that year, and then thereafter maybe 2 or 3 times a year to keep this basically condition under, you know, control and maintain it a little bit.
Yeah. If you like these videos and you like the information that you're getting, please click on the subscribe button, and there's a little alarm. So if you want an email every time a new video comes out, hit that alarm button as well. And where can they find you, Dr. Bashey?
So I'm on Instagram, Dr. Bashey. I also started a YouTube channel of my own, but it's not as successful as yours, I have to say. It's SameerBashey.
SameerBashey.
There you go.
Okay, thank you
All
so
right.
much. Doing these little things to kind of always improve your skin, that's a really good way to live young. Thank you.